Engaging in conversation about health and safety, workers in the service sector in general, and retail specifically, are sometimes overlooked. We'll talk with someone who's done specific research on the safety of workers in retail. Up next on this episode of the Psych, Health, and Safety USA podcast. From Flourish DX, this is the Psych, Health, and Safety USA podcast. As workplace mental health has become a global priority, there's a greater focus on addressing psychosocial hazards. Each week, we look at psychological safety from an occupational health and safety perspective. Let's talk psychological health and safety. Welcome to this episode of the Psych, Health, and Safety USA podcast. I'm your host, Dr. I. David Daniels, and I want to thank you for tuning in. Our goal for each episode is to increase awareness of the importance of psychological health and safety by learning from the lived experiences, research, and expertise of our guests, as well as advocating strategies to reduce harm and minimize vulnerability to psychosocial hazards in the American workplace. In this episode, we'll be shining a light on a sector that employs millions of Americans, yet rarely gets the attention it deserves when it comes to safety. It's retail. So my own introduction to the world of work started in retail. I was 17 years old, barely out of high school, reporting to a store at 5 o'clock in the morning. And my job, offload a full semi-trailer of merchandise alone. No real training, no guidance on how to protect my back, my mind, or my life. Just a directive to get it done. And the truth is, if luck hadn't been on my side, I might not be here to even tell this story. That experience isn't unusual. Retail workers face a complex mix of physical and psychosocial hazards every single day. Heavy lifting, repetitive motion, understaffing, unpredictable schedules, customer aggression, chronic stress, and the constant pressure to smile through it. All of these shape the reality of retail work. And while we often think of retail as an entry-level or low-risk environment, the data tells us a very different story. Retail workers experience high rates of musculoskeletal injuries, workplace violence, burnout, and psychological strain. Yet systems designed to protect them often lag far behind. So today, we're going to talk about what's really happening behind the counter in the stockroom and on the sales floor. We'll explore the physical and psychological hazards that too many retail workers are expected to simply absorb. And we'll ask the question, that should guide every workplace conversation. What would it be like if retail workers were actually safe physically and psychologically? So we're going to start with someone that I met at a distance as participants in the International Symposium to Advance Total Worker Health held some months ago. And I was I actually took time out, not only being a speaker, but to listen in on some of the sessions. And I heard this one. I went, I've got to have this person on the podcast. So let's start with an introduction of my guest, by my guest, with this question. Who is Dr. Colleen Brents?
Thanks, David. Thank you for inviting me. I'm very excited to be here today. Who is Colleen Brents? Who am I? I am a health and safety practitioner. I live in northern Colorado, United States, and my background is environmental health and occupational ergonomics and safety. And so how I got to here is a little interesting, I like to think. I started out in environmental health at Colorado State University, which is just how human health is affected by our environment. That can mean so many things. There's just like air quality, food safety, chemical exposures, and what piqued my interest was how humans interact in their physical environment. So that took me to ergonomics. So then I went to grad school, and that was sponsored by the National Institute for Occupational Safety and Health, where I studied how occupational ergonomics and safety. And so my focus on that is how humans interact in their work environments. But like the choices that we make when we're in those work environments, that gets into that some that psychology and that behavioral component. So while I was doing my doctoral research on occupational ergonomics and safety, that's where I also got into total worker health, which is that more that framework for all the different factors in our community, our work environment, and our home life that can affect our well-being. So while some people will say ergonomics is like the head down, I do think there is that behavioral component, and that's where you get into psychological health and safety or psychosocial risk factors and that kind of thing. So after Colorado State University, then I went into international consulting. So now I'm at Antea Group, that's an international environmental health, safety, sustainability consulting firm where we work with companies around the world dealing with different health and safety topics.
Wow, a lot to get into. A lot to get into. Yeah, there's something you said, a thread I'm going to pull, that connection between how our minds think and how our bodies behave, because sometimes people want to separate them. But before we get into that, what does psychological health and safety mean to you? When you hear that, what types of thoughts come to your mind? What does that conjure in your mind?
Yeah, great question. Psychological health and safety to me basically is feeling that you have a voice at work, that you can speak up, and that it's not going to just go into the void, never to be acknowledged, or nothing will come of it. And then also you can speak up and without fear of like retaliation or some sort of negative consequence because you spoke up. Um, I also think there's importance of like that like training or education to recognize when there's something that doesn't feel right, and that difference of knowing, oh, this is just the way it is, probably not, and recognizing it and then being comfortable saying something about it.
Right. Yeah, yes, I asked that question of everyone because uh, there's kind of to be quite honest, there's kind of a textbook kind of answer thing, I guess. But who goes out and reads a textbook before they decide how they're going to be psychologically healthy and safe at work? It's how people feel. A lot of it is about, and do I feel like I could speak up? Do I feel like the environment is for me or against me? Do I feel safe at all? And a lot of that is totally dependent on the person, because you could have these excellent systems that are set up by really professional people, and you could get that one person who, I don't know anything about safety, I just know how I'm feeling today. And I think it's important for organizations to recognize that and pay attention to that, because that small interaction that causes a person to feel a little safer right now could save you thousands and thousands of dollars in terms of, slip, trips, and falls and back injuries and lifting incidents, because the person feels more secure and feels safer in the environment that they're in. And I want to go back to something that you said in your introduction. You said that you feel like that there's a connection between how people feel and even how it affects them ergonomically. So tell me a little bit more about that view that you have.
Yeah, that connection between the mind and body. And so I think, yeah, like you could have the most perfect work setup and it's designed to reduce, and it's designed, yeah, to reduce some awkward postures, or you have some tools to reduce some like high grip strength or whatever. But if you're feeling rushed, if it's 5 a.m. and you're the only one there and you didn't have any training or anything, your people are just gonna do whatever it takes to get it done. And if that includes some shortcuts that weren't engineered out or something like that, that external pressure can override the whatever systems you have in place to try to protect the worker. So that's where it's really important to understand, like, no, like the company like does value my safety, or like it is more expensive, or if I mess up here, that's going to cost more time and energy and waste. So like I should do it the way I was trained, or I should do it the right way. And it's not worth it to cut those corners necessarily. So yeah, those external pressures and like rushing or feeling like you have no freedom or choices, that can drive how you interact maybe poorly in some systems.
Yeah, yes. Of all of the kind of safety related conversations that we have, the one that I believe that is closest to the conversation about psychological health and safety is ergonomics. And here's why I say that. I say that ergonomics, my understanding about ergonomics is it's this focus on designing the work around the person as opposed to the person around the work. And that is super important psychologically as well as physically, because what we've done as a society is we've built this kind of industrial standardized approach to everything that says it has to be done this way. And we forget that humans come in different sizes, different views of the world, different experiences, different everything. But it's like people have to fit themselves into this box that was designed by whomever that had probably a lot of background and a lot of, but you didn't think about this particular person. The example is the work that's done around vehicle safety. Many of the crash dummies, and they are kind of because they're not humans, or uh, they're designed as, first of all, they're designed male, and they're designed, average height male, average weight male. But what about the undersized, the under the average size males and females that don't fit? So seatbelts hit at the wrong level, and steering wheels and all these kinds of things that weren't adjustable back in the day had different impacts on different people. And I'm not here to suggest that that was done intentionally, but it was done because people didn't design the environment around people. They tried to make people fit the environment. And so it's one of the things that's so interesting and important about ergonomics in general. So what drew you into the interest around specializing around ergonomics?
So I guess, yeah, looking back, it's funny. It's always been there. Like I used to be really into rock climbing. I used to compete, coach, all that, and that's literally how are you moving your body to get up a wall? How can you position yourself and interact with that environment to move? I was also really into art and like figure drawing and anatomy. Again, the body in space. Um, and so that's always been there as like a hobby, right? And then when I was in school doing environmental health, I actually started out in radiation biology and like cell cultures at like very small scale. And I remember thinking, I want something bigger. And then I went down like an anatomy pathology rabbit hole, and that was like the body systems internal, but still too small of scale. And so then ergonomics took me back to our bodies in systems and how we're interacting with the broader environment, and that's where ergonomics just clicked for me. So
Okay, so uh, you go to school, you're interested in environmental health and safety, you start focusing specifically on ergonomics. So, how do those two things lead you to do research or this project around retail workers? Because, again, just in general, it's I can see someone ending up in the organization with now doing international work and with with companies and corporations across the world. So how does one get interested in a retail setting? How did that come about?
yeah, there's so many industries out there. How retail? So let's see. So I work with a lot of multinational companies. So companies that have maybe their headquarters are in the US, but they have offices all over the world, or they're based out of somewhere in Europe, but then they're new to the US market. And so companies, a lot of companies, yeah, understand that the value is in your workers and having healthy, safe, productive workers. But sometimes like they don't know how to do this. And one approach that I've seen pretty successful is a regulation in one country where they have a presence that can be like that catalyst so for implementing across all of their offices and all of their sites. So lately, I've seen an increase in some sort of regulation around um, uh, psychological health and safety. And usually those regulations use the phrases like psychosocial risk. So that's more of the risk that would impact psychological safety. So psychosocial risk, that's where you get like the work pace or rushing or those external factors that can like lead to burnout and reduce productivity and that kind of thing. So a lot of these regulations are aimed at addressing psychosocial risk. Um, and these regulations vary. They could be just have a policy, have a program, have some sort of survey, have some sort of training. It all kind of varies right now. And so, for instance, like New York City or the state of New York had a retail worker workplace violence prevention policy. Um, and so, and that one was started very recently. And so that was a catalyst for this specific project. And right when New York was having this regulation, California was also having one for general industry, which includes retail. Um, a lot of these regulations have some sort of head count. So if you have 10 or more workers, you have to do this. If you have 5 or more workers across all of your sites, you need to do these things. And so workplace violence has been a focus in that psychosocial risk that I see come up more often because especially retail workers in particular, they're interacting with the public daily. Um, and so it was nice to see that, yeah, the risks with that interaction have been identified, and then companies are recognizing like we should do something. Now, is that having a policy and just addressing it? Is that having a training so workers know to recognize signs and how to respond accordingly or de-escalate? Is there having like some sort of reporting system? What does that mean? So those regulations coming up in different countries, and if a company has a presence over there, and for consistency, they want to do it across the board. And then specifically that New York retail workplace violence prevention plan has been a catalyst for a lot, especially in that retail sector, and the California one too.
So the regulations in the state of New York cause you to focus on retail workers in order to help these companies. So they want to continue to they want to take care of their workers who just happen to work in New York or who just happen to work in California. And again, I that is actually encouraging, and it to me, I know a lot of big companies and small companies alike don't necessarily like regulation, but
Yeah.
not but hopefully a lot of this regulation is in place to do the right thing. I mean, and to me, the right thing is always taking care of the human beings, because the extent to which you take care of the human beings will allow you to make more money, will allow you to keep customers and all that type of thing. Because when customers, even customers sometimes who aren't, really the nicest people themselves, but if they get a hint that you're mistreating workers blatantly, then you'll find people kind of backing away. Well, I don't want to really be associated with someone who isn't taking care of their workers. Yeah. So talk a little bit about some of the elements that were involved in the work that you did in this retail project.
So for this project in particular, so that workplace violence prevention plan kind of kickstarted this broader um, psychosocial safety initiative. And that's pretty broad. So the way they decided to start was, let's just focus on our like wellness resources that we have for our employees across the US, not just New York, for all of our offices. We have a wellness program in place. Let's see if they know about it, if they use it, what do they want to see in it, and that kind of thing. And so that's where we designed a survey to ask that of the employees. And so whenever you're asking employees about kind of sensitive topics like that, because it was, yeah, how do you perceive like management support of wellness, and like what kinds of resources do you see, do you feel comfortable using them, that kind of thing, and then some free response too, like what would you like to see. Um, Anytime you're asking kind of sensitive questions like that, it's really important to figure out or think about like, how are you asking? How do you convey that it's not, well, first off, it should be anonymous. And then how do you communicate that it is indeed anonymous? One challenge that I've seen with these types of surveys is how do you communicate who's asking the questions, right? So is it just tied to that company's HR, and then they're going, and then it's how do you ensure that that privacy is guaranteed. So since we partnered with this company, we were the third party, right? And so that provided that disconnect. And so then the survey, it was provided digitally through like a QR code. They had a certain window to respond, and then we did track like what office they were affiliated with, but that's because, or which retail store. But that's just because they had a large enough headcount per facility, um, that it would be really hard to like tie it back to an individual person. Um, so yeah, one challenge, I was on another early stages of a project, and they wanted to do a similar survey, but they had really small stores. And so it was a challenge like, well, if the manager from this site says this, you probably know it's this person. And that kind of defeats the purpose of the survey. So how do you preserve that anonymity? So really thinking about your target audience, the head count, the geographies, and how do you group things to preserve that anonymity. So we surveyed this company, asking about their wellness perception across the board, and then it was a combination of like litmus on a scale of 1 to 5. How well do you agree with this? We also looked at were they management versus an employee versus their role in the company to see what relationships we found with that, and then like a free response as well. And then we summarized the results and then shared that with upper management, and then they took certain components that they deemed most appropriate and then communicated that to like the sites, and they were going to include that in like their weekly safety briefings and stuff to share the results back to the employees.
Do you need more psych health and safety in your life? Then head over to the Flourish DX Academy for several free on-demand e-learning courses. If you're an internal professional, follow Flourish DX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the Flourish DX Academy. www.45003.org. Now back to this episode.
While I'm listening to your description of this survey that you did, I find it interesting that the environment that's already in place informs your ability to change that same environment. Because if the environment, if it's already a place where people feel like, I feel okay speaking up because they aren't going to come down on me because they support me. As long as I've worked here, I've always felt kind of supported. It's not perfect every day. If it's that kind of uplifting, supportive kind of environment, you actually get more out of people about what's not going right. On the other hand, the organization who has already created this kind of culture of fear and that type of thing, the problem that creates gets covered over all the time because people are so afraid and people won't speak up, and they watch and they know that the last person who spoke up, they kind of vanished or they didn't get promoted or whatever. So it becomes this, again, self-reinforcing system. The safer people feel, the more safety you'll actually get.
Exactly. And yeah, I think that's a great point to bring up too. And it's important to note, so surveys are a tool that you can use, but it's important to understand the environment. Is a survey the right step, or are there other things to do beforehand to try to shift that culture so that people feel comfortable participating in the first place? And we were fortunate that this company already had that, and people were already open to participating and that kind of thing. But there's if you don't do your homework ahead of time, there's a chance that, oh wow, everyone scored 10 out of 10.
Right.
Wow, it's perfect.
Right.
Wasn't there like an injury though, or like others? And then so one way that you can kind of get an idea of that existing culture, sometimes one way that I've seen is looking at injury logs. Are there injury logs in the first place? any sort of tracking. And then also, yeah, like near misses. So I think, yeah, the idea of a near miss tracking speaks so much, can give so much information into an organization. Do people understand what a near miss is, circumstances that could have caused damage to property, life, or the environment? Did they recognize that it was a near miss, and did they feel comfortable reporting it? So some companies will track those informally, some people don't, but that can give a real good insight into the communication culture within a company.
Yeah, totally, totally. Yeah, something, and again, and you mentioned it earlier, the tracking of psychosocial risk. So a little bit of a soliloquy here. I do not believe that risk exists in a vacuum. It didn't just pop up from nowhere. Risk is the product of exposure to a hazard that you're vulnerable to. And often that's the issue, is that people don't know that it's a hazard. They don't know that that thing will harm me. I feel something, but I've never really focused on where that comes from. I just kind of normalized feeling this way. But what is it that's causing people to feel that way? And even in organizations that are trying really hard on the physical side. So, you talked about it earlier. We brought in an ergonomist. We looked at every desk. We've got the standing desk and the chairs, and we've got all these, we have, back supports when people lift. We have all these things. But what we don't have is a focus on the time pressure and the understaffing. And so we got all the physical tools for this to be safe. So why are we still getting, musculoskeletal injuries? Because it's not about the tools. It's about the environment that you put the person in with the tool. It's about the supervisor feels this pressure to get X number of units out the door, but human beings are putting those units out the door, and the human beings can't catch up. And when the human beings bring it up, they're told, oh, we've got a quota, and you got to keep going. And it's kind of this, kind of industrial sweatshop type of mentality that doesn't work well for human beings. And it's working even less effectively as our generations are changing. As folks like who are, I don't know how many birthdays you have, I want to ask, but I think you probably had fewer than me. And I think generations have watched their parents and their aunts and uncles go into work and come home just physically and emotionally beat up, and they're going like, yeah, I don't think I want to do that. I think there's a better way. And I really know that doesn't work for me. You're going to have to do that different. So I'm saying all this to say that it's really important that we get to the root cause of what's causing people to feel the way that they feel at work. That question has to be asked. And let's really pay attention to that and not have these kind of sacred cows. Oh, and the example is, we are still evaluating what an effective work week is based on what people worked in 1938.
Mm-hmm.
So
yeah.
I just wonder about that. I wonder about that. Yeah. Yeah. So you said that, what's your perception anyway about the differences in how the leadership and the workers were feeling as a part of this project? Did you see any differences there?
Yeah, we did observe some differences on those perceptions of the resources between management and employees. And then I've also seen a similar trend from other studies. I don't believe it was a vacuum to this specific company. But basically, management and people, so supervisors, managers, people in those more managerial roles, had a higher perception or greater agreement with the idea that the company was providing support for these wellness resources. Or, for example, my manager fosters a positive and supportive environment that considers employees' mental well-being. Management had the highest agreement with that, compared to stock or sales associates had lower agreement. Or another one is, the company is committed to the wellness of its employees, or the policies encourage wellness and stress management. So across these questions and similar questions, management was like, yes, like I agree that we are supporting this. Whereas those other roles were more likely to have some variation, or like maybe not as much as I would have hoped for. And so that just highlights, yeah, like there's that disconnect between those different roles within the company. And then, yeah, if you dig a little bit deeper, typically, yeah, like those management positions are going to have a little bit more like autonomy, more schedule flexibility. It's the sales and stock associates that they're the ones on the ground dealing with those holiday rush crowds and maybe the disgruntled customers, and so they're the ones like really in it with those peak stress environments. Um, so yeah, so that was a perception difference that we observed.
So it sounds like the people who are actually closer to the hazards were more they because they were closer, they were exposed more often. Their perception of the hazard in general, their perception of the environment was different than folks who kind of pop in and out. What kinds of what do you tell organizations when you find that out? What are some of the ways that they can address those differences in perception from your perspective?
Yeah, so what do they do next? So I want to highlight that, yeah, so this was a baseline survey. So this was the first time they had ever done anything like this. So this is really like setting, where are you starting at, right? Um, and so I think that's one reason that perception gap was so observable, was because, yeah, like they haven't looked at this before. So it's great that they are. And so yeah, so I think if you just go to management, like there's a perception gap. Like management thinks this, workers think this. Like unfortunately, that's not terribly surprising, but what do you do with that? So that's where some of the other questions in the survey really gave us that guidance and direction to suggest those next steps. So some of those themes that we identified from some like free response questions or from the rest of the survey was like the store security or like work hours, respectful communication was a commonly observed theme. And that goes with, yeah, like that high pressure, like working now and that kind of thing. And so those themes give some tools of, well, is there, what's the phrase? There's like communication trainings that can be administered to upper management or employees in roles where they're frequently training or talking to others, and how to have respectful communication, active listening. What are some keywords, some body movements, and that kind of thing that you can do that can help promote a more inclusive environment or can promote more respectful communication. Um, and yeah, looking at, I mean, staffing is always going to be a challenge, especially during like holiday hours and stuff, but looking into that, or employee resources. There was a lot of comments about like break rooms and like the either the cleanliness or the environmental components, like the HVAC or the heating or that kind of thing. And so you can submit a ticket to facilities to look into it, but then this is just another avenue to raise awareness for that. And so I think some of those themes and observations can help bridge that gap. And if you address these things, that can help improve that perception that the company is paying attention and does want to understand better.
Wow. And some of the things that you said to me really sound, they actually sound pretty simple. They're not super complicated things. People who work in, places, in the from Arizona all the way over to the state where I live, it gets hot in the summer. It is. And little things like air conditioning, or things like having a break room that's bigger than a closet. Just small things like that, on the part of the company, because many of these companies, I got to be honest, they're making hundreds of millions and billions of dollars. So the investment that it would take to make some of these changes on the scale of things really wouldn't be that much. And sometimes people look at these and it's all about wow, that's going to impact our bottom line. But that small investment brings you so much on the back end because of how it helps the humans to feel.
Exactly. Yeah. And surveys, and yeah, like when they see like a big list of like, oh, like HVAC across all of our facilities, or um, HR trainings across all our facilities, surveys like this can help prioritize and pinpoint like, well, do we need to do everything? That does seem like a big ask sometimes. So how do you prioritize and develop a plan to address some of those challenges?
Yeah, absolutely. Because, there is, and this goes back to the conversation we are having before, there is a lot of tendency for organizations to try to look for the standard answer for everything. Okay, if we go out and spend $7 million and upgrade all of our air conditioners, it's going to be okay. Well, not really, because there's these four sites over here, but that one over there, the air conditioner really isn't the issue. The air conditioner works fine. It's this other thing. And are organizations okay? And even, as safety professionals, are we okay having this really tailored approach to safety? Safety can't be standardized all the time. It just can't, because people feel differently. So there is the safety things that you do, and there's the safe that people feel or don't. And they're not always the same thing. So we did all this stuff. Why don't people feel it? There's a lot of reasons why we did, and some may have nothing to do with us, but they are what they are, and we have to be. I think it's important that we be cognizant of the fact helping people feel safe is much more important than the things that we do that are standard. As to ask, yeah, it's simpler to ask, and when you ask, so if you aren't going to do anything with the information, you probably shouldn't ask.
Yeah, thank you for bringing that up. Yeah, so that's a great point. Yeah, the next step. So after you do this survey, I think it's really important that what you do next is almost as important, if not more important, than the survey itself. Because, like I said earlier, if things just go into the void, like employees took time out of their day, whether out of their work day, out of their personal life, they took the time to complete this survey. How are you going to respect their time and the effort they put into this? So that's why it's really important. Yeah, ask questions that are going to be like within the bounds of something that you could take action for. And then it's important, yeah, to like summarize the results in a timely manner, to share it, and then share some outcome from the survey with the employees themselves in a timely manner. Like, yes, we saw this. Yes, we heard this. This is what happened from that thing you did a couple weeks ago or a couple months ago. And then if there are like, thank you for participating. Here's what we saw. This is what we're going to do. So that's a really critical component of that. And then another important thing is more follow-up. So I mentioned this was like a baseline survey. This was the first time they'd ever asked these questions. To see how things change and evolve, it's really important to survey again. But you want to be mindful of the timing when you ask those questions again, because survey fatigue is a real thing. Yeah, you can't message people weekly or even like multiple times within a year. Like, I just did this. What do you mean I have to do this again? So being really mindful and deliberate about when you do those follow-up surveys is another very important thing to note.
Yeah, and I think it's also important, and you talked about the importance of taking action. I think it's important to communicate and connect that action to the survey that you had. And there's, to be quite honest, there are some cases where you can do a survey, you can get the feedback, and there may be something you were probably planning on doing anyway. You're kind of heading that direction. That feedback from the survey helps support something you were probably already going to do. But people have to know that you did it, because I find that there are a lot of organizations out there who do a lot of good work, but they don't tell anybody. So nobody knows. So, we get into the leadership huddle and we talk about, we have our metrics and our dashboards and all this, but you never communicate that to the people that are affected by this. So they don't know. I mean, they have no idea that anything changed because it didn't feel like it changed for them.
Exactly. Yeah, and that was a finding from the survey is people like, oh, I didn't even know we had these as an offering. So that's a very low-hanging fruit or easy fix. Just communicate that you have these resources.
That's right. That's exactly right. Yeah, yeah. So you as we start to wrap the conversation, have you had organizations that have done the initial, and you've seen gone back and done another round, or work with these companies long enough to start to see some results?
Um, so that's yeah, the one difference I've noticed from my grad school research versus consulting. School research, yeah, we would partner and get to see things from start to finish and have that follow up. Consulting, depending upon the relationship with the client, you might not see that follow up as much as I would as frequently as I would like to. I remember this client in particular, I mentioned how they wanted that broader psychosocial risk and the wellness was the first initiative. They are planning another survey in that psychological health and safety umbrella. Um, and so they're planning, so it's not going to be the exact same questions on like the wellness resources. It's going to be broader on more like work stress and that kind of thing. So they're planning that survey actively because this was just about a year ago. And then anecdotal feedback I've seen from other clients from similar projects is yeah, like it was like a catalyst for that improved and increased communication and they did notice a decrease in injuries even too. Which is nice. But yeah, fostering that collaborative and communicative environment.
Yeah, that I think that's an important point. I'm a I'm a pro football fan. I can't say I'm even a sports fan. I'm a pro football fan who likes a couple other things. And but when I think about sports in general and team sports, and there's a connection I want to make here. Often the owner and the coach will get really so antsy about winning, whatever that means, that they're constantly turning over coaches and players and through this cycle, and they never really get there. And you made me think about this when you talked about how companies will reach out and will get a third party to help us with this part. But because we won't keep the relationship long enough to actually see the results, then we ought to get another one. Then we get another one. And every time you turn around, you're bringing in somebody else. You do need to have some outside kind of view of this because you don't have the expertise yourself. That's obvious. But on the other hand, if you continue to change over and over and over, the help can't really help you as much because you kind of keep changing your idea about what help looks like.
Yeah, it hasn't had a chance to really affect that change. Yeah, it's that more that reactive response instead of a proactive and like leading indicator approach. Right, yeah, or the way I see it is, yeah, it's like I'll work with you and give you like the tools so that then you know how to keep doing this, and yeah, because it is a continuous process, and yeah, how can I set you up for success to keep doing this? Because these people, yeah, in retail in any industry, those individuals they know the environment the best. They know what those work stressors, what the demands are and stuff. And so this third party coming in, it's like, well, how do you know what I'm doing? And so it's like, I don't, but I can provide some like, but like communicate with me, show me, And maybe there's something that you're already doing that you don't realize, and I'll help you identify that, and just help sort through like their ideas and figure out what aligns with their goals and that kind of thing.
Right, right. So let's say there's someone out there right now who and particularly I think these kinds of efforts are really important for new and emerging businesses. In the last data I have in 2023, right about 5.4 million new businesses were formed, and about a third of them actually became employers. And those are the ones who have the biggest issues, is the ones who go from a business idea to an employer. And people are really good at their business idea, but they're not really good at the employer part. The human part, particularly, that's not their thing. I'm a scientist. I build, cars and trucks. I manufacture things. I know about chemicals. But yeah, sometimes the human part, but the lack of focus on the human part is what keeps the lid on the size and effectiveness of that business idea. Because unless there may be a day in the distant future where you don't need people at all, but you're at least going to need people to buy your stuff, I think.
Yeah, and that goes back to why I like ergonomics so much, is because there's always going to be at least one human interacting with the system.
That's right.
Whether they're buying it, whether they're doing like maintenance on the data system or whatever, like there's always going to be at least one human somewhere in the process.
That's right.
So you need to consider that.
Yes. And how do we create great environments for humans? Mm-hmm. That's the question. Wow. So much more we could chat about, but if folks wanted to reach out to you, learn more about the research that you've done or some of the work you're doing in the future, what's the best way for people to find you if they wanted to do so?
I'd say LinkedIn is probably going to be the easiest way. They can search just my name, or I think, my website's, it's linkedin.com/in/Colleen Brents. So, that's probably the easiest way to find me.
Well, right on. Thanks, Colleen, for spending some time. It is, like I said, it's good to know that there are folks who are concerned about the folks who are in the service sector. There's a lot of value there, and one of the things that I do when particularly when I go into like restaurants and such, I find myself always asking, what is it like to work here? Because if I get the sense that it's not a good place to work, I probably will. And generally, I even talk to the manager or the floor leader, or whatever it is. You all need to do a better job of taking care of folks here, because otherwise, folks like me probably won't. It's now there's an argument to be made about that's kind of costing folks jobs, but I think we have to be bold enough to stand up for the humans so we can get those workers in a place that will treat them well, because these workplaces should be healthy workplaces, both physically and psychologically. They're never going to get it perfect. I get it. It's not going to be great to work there every day. I understand that as well, but that should be the priority. Treat the people really well. And as we do that, we're going to, we'll make money, we'll grow, our business will do well, and it'll be good for the rest of humanity. Yeah. So, Colleen, thanks very much for what you shared. Anything you'd like to, last comment before we sign off?
I guess, one takeaway is, just next time you go to a retail environment, remember, everyone's like, they're doing the best they can with what they have right now, and just, be nice.
Yeah, be nice. Thanks so much. So, if you're watching or listening to this podcast for the first time, welcome. I hope something that you've heard will bring you back to a future episode. Previous episodes of the podcast can be found at psychhealthandsafetyusa.com. You can watch, like, subscribe, and share the podcast on the Flourish DX YouTube page. And please do join the Psych Health and Safety USA movement by connecting and becoming a subscriber on LinkedIn. So until next time, stay tuned and look out for the next episode of the Psych Health and Safety USA podcast. Tune in each week for new episodes of the Psych Health and Safety USA podcast. If you have a story or know of one that needs to be told, reach out to us on LinkedIn or send an email to david@id2-solutions.com or go to the Flourish DX website at flourishdx.com. We'll see you next time.